Presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Case 15. Chief Complaint. A 40-year-old male presents to the emergency department with acute onset of severe left-sided chest pain. The patient describes sudden onset sharp chest pain that started while he was lifting heavy boxes at work. The pain is localized to the left side of the chest and worsens with deep breathing or movement. He denies radiation of pain to the arms, dyspnea, which is difficulty in breathing, palpitations, sweating while breathing, or fever. Past medical history. He does not have a significant past medical history. He is not a smoker. He is currently on no medications. He doesn't use alcohol or any sort of drug. Works as a warehouse manager. His father had myocardial infarction at age 50. Physical examination shows BP 130 systolic, 80 diastolic, heart rate 70, respiratory 16, temperature 98.2. His cardiovascular region shows regular rhythm and no murmurs. Respiratory region shows clear breath sounds bilaterally. His abdomen is soft and non-tender. Initial differential diagnosis: musculoskeletal pain, pleuritic chest pain, pneumothorax, pulmonary embolism, acute coronary syndrome. Based on this presentation, what do you consider the most likely diagnosis and what further investigations or management steps would you recommend? So, what is pneumothorax? Pneumothorax is basically whenever the air leaks in the thoracic region. It could have occurred due to any sort of trauma which was faced by a lung. What is acute coronary syndrome? Whenever there is diminished or complete absence of blood supply to heart, to its coronary circulation. Pulmonary embolism, as the name suggests, there is an emboli that is circulating throughout the pulmonary circulation. Pleurisy is nothing but pleuritis. Whenever the pleural membrane gets inflamed due to any sort of infection, that leads to pleurisy. So, with whatever information we have, and there is no radiation to the arms, a key finding, it's a likely diagnosis of musculoskeletal chest pain. Why? Because there is sudden onset and sharp quality pain. Whenever he's trying to take a deep breath, the pain is actually increasing. It is a classical finding of musculoskeletal chest pain. At the same time, the person said that the pain started when he was lifting heavy boxes, right? What would be the next steps? First of all, we'll try to get him off the pain. We'll give him non-steroidal anti-inflammatory drugs or acetaminophen for the pain relief. We'll give them a hot or cold therapy. We ask them to take rest and apply ice packs in the affected area so that the inflammation will be reduced. We'll ask them to not lift heavy boxes for quite some time now so that any sort of trigger to that area does not occur right now. And we'll monitor the patient's response to the treatment and consider further investigations if the symptoms persist. If it worsens despite conservative management. Are we giving him any steroidal drugs? Long-term uses of steroids works like drugs itself, because you have to give them more and more with each resistance develop to have the same effect, and that is not healthy. Hope you like the case study of today. You can come back whenever you want to sum it up. Please make sure that this is not a substitute of medical advice. Corrections or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.